My name is Helen Bujak, and I am the owner and founder of West Valley OBGYN. We are a women's health clinic located in the underserved area of Maricopa County, Arizona. The patients that we serve in this area are obviously primarily women. We do have a very large Hispanic population as well as an African American population. This population is a very hardworking population, and they've faced a lot of discrimination, hardships, and so having access to multiple things from even transportation, internet services, and even ability to have time to take off work that they need to be able to support their families. So we are trying to meet in the middle of how they can get the specialized care without having to go outside of the community. One of the big things that we have found as serving this underserved population is access to specialty care. So about a year and a half ago, Dr. Patil came to our office with this proposal of this Nixxi program. And it was a way that integrating technology, which even now most of the patients can have phones or they get access to internet some way or the other. But this is a way that we can get a questionnaire and we can fit them and we can screen them for risk factors as early as the first visit and make that connection. And so when he first came to me, I was really excited about it, but I said, I want more. I said, let's take it to the next level. So how do we get you involved early on that I can get you here in my office? Because I can send referrals out to specialists all day long, and the patient then has to go to an office in Scottsdale, the other side of town, into an office that they don't feel comfortable, they feel judged. It's challenging to get them in, it's challenging to navigate that system. And so what happens is they don't seek that care. So then we're still serving them blindly, even though we know that they need to talk to a specialist.
As the CEO of Nixxi, one of my challenges was to create a virtual care platform that was intuitive and that worked together seamlessly. Early on, we evaluated a range of telecommunications options, looking at which platforms would be ideal for telehealth, which platforms were dynamic and could really meet our need. As we looked around, what we realized was that BlueJeans by Verizon really was an ideal partner for us for a number of reasons. Every telecommunications platform will allow you to have a face-to-face, or at least a video face-to-face conversation with a patient. That's a standard and a given, but when you're trying to provide care to a patient, it goes well beyond that. Nixxi's platform is really focused around the idea that we can create individualized care pathways for women based upon their unique characteristics. We use BlueJeans Telehealth to facilitate getting data and incorporating it into our counseling. And that could be data around what is her chief complaint at a visit, what are her vitals, what is some data that she's been collecting on her blood sugars, blood pressure, her steps, activity level, even her sleep patterns. We're able to download that during the visit and incorporate that into our counseling and her care and management plans.
To just kind of walk you through a scenario of how it works is, so when our patients check in, we have our front desk, they have a QR code and they scan it from their cell phone. If not, we have a tablet up front, and it goes through and asks them a series of questions about basic history, focusing on their maternal history, their pregnancies, what they've experienced from first menses, their sexual behaviors, things like that. And this is what basically comes in and spits out and goes to Dr. Patil for review, and he decides these outcomes. The second time they come, we now have this report that tells them, hey, you know what, you have some risk factors under A, B, or C. And then what we would like to do is we'd like to set up you to speak with our maternal fetal medicine specialist. And we can do that in one of a couple ways. We can set you up a telehealth medicine appointment through BlueJeans, our program that our provider uses for their telehealth. And we can, at that point, you can either do it from home or we can do it here in the office with them. And so we give the patient the autonomy to work what is best with their schedule.
In my experience, working with patients using BlueJeans Telehealth as part of Nixxi, we found that the user experience, both on the patient side and on the provider side, has been intuitive. It is straightforward to be able to send an invitation to patients, for them to receive reminders, for them to click on the link and go directly into the visit. Furthermore, during the actual clinical interaction, not only do you see the patient, but you have the ability to utilize the whiteboard if you want to draw out notes or diagram out a clinical concept with the patient. You have the ability to collect data from the patient. A lot of these features make that interaction with the patient more than just speaking. It makes it a more interactive experience. This feature set is better than what we found in other places, and quite frankly, it's still the starting point. We see this continuing to develop, and we see ourselves as having a partnership that will continue to evolve with us as the nature of telehealth evolves over time.
This is the way that medicine's gonna go. This is going to change the standard of care when it comes to women's health.